Hi everyone, I am Dr. Sagar Sahu and welcome to Vet Surgery Teach. So today I welcome you to the fifth lecture in the series Regional Surgery. I have already made 4 videos. I will give the link in the description to the playlist, and as well as at the end of the video we will get the link to the playlist. I have already made one video regarding eye in the previous class. If you have not watched, please do watch that beforehand, because there are some anatomies and as well as some terminologies. We'll also explain those in this class and subsequent classes. Actually, in eye we'll cover it in 5 classes. I have already made one class, the basics, and in rest 4 classes including this one we'll discuss different structures and their surgical affections, structures related to eye. Okay, so if you have not watched that previous one, please do watch it. I will give the link in the description as well as in the last of the video. Okay, so today we will be dealing with the eyelid and the nictitating membrane, that is the third eyelid. Before going to the video, some formalities. Do follow me in the Facebook and Instagram. Instagram is more important. I am more active in Instagram rather than in Facebook. Okay, I am not that social media kind of a guy, but I do post in Instagram, especially the video update will get in the Instagram. This is the book which I am referring. Very good book, very fundamental book. If you want to be an ophthalmologist, you can refer this book. I am not an ophthalmologist, okay, but I refer this book whenever there is a case of eye. This is a very good book. You can refer this one. Okay, I have made all the PPTs of eye when I am discussing eye from this book only. Okay, so first one is the coloboma. Coloboma is a generic term. Okay, coloboma means congenital agenesis. Coloboma of eyelid simply means agenesis of eye. Coloboma of iris, congenital agenesis of iris. Okay, so coloboma is basically the congenital agenesis, congenital absence of a portion of eyelid. You can see in this picture, this particular portion is absent because of congenital reasons. Okay, this is congenital agenesis or coloboma of eyelid. Most common in case of cats. The surgical repair is known as blepharoplasty. We'll discuss some surgical repairs. If the defect is small, kind of if this length of this defect is less than 1/3 of the eyelid, then there is a surgery, that is wedge resection, removal of the edges of the defect, create a wedge defect. We'll see some images. Then sutured. Okay, care should be taken for accurate apposition, because if you will not do the accurate apposition, there will be mismatch. We'll see in the images. And suture should not irritate the cornea. It is very important while doing the wedge resection. For larger defect, you may need extensive reconstruction like H+T. Okay, we'll see all those things. Okay, don't worry. H+T. This is basics of coloboma. This is the surgery. This is wedge resection. Wedge resection surgery. See, this is a technique actually. This wedge resection is a technique which can be used for surgical corrections of, first one I told you, coloboma. It can also be used for entropion, depending on the degree. Okay, entropion, as well as it can be used for ectropion, and also it can be used for neoplasia, small neoplasia, not bigger one, small neoplasia. All those things, for all those things, this wedge resection surgery can be used. Okay, so what is wedge resection surgery? Simply suppose this part is having agenesis or coloboma, or suppose there is a small tumor here. Okay, or this small part has been having some ectropion or entropion. Then you have to identify these 2 points. Okay, using a surgical marker, you can identify those points and you have to draw lines. Okay, whatever length required. Usually what happens, suppose this is 1 centimeter, this length. So the apex, this height, this here will be the apex of the triangle. Okay, so this height should be twice of this one. If it is 1 centimeter, this will be 2 centimeter. Okay, what this base is 1 centimeter, then the height should be 2 centimeter. Then you have to make a triangle and this triangle should be removed. Okay, understood? Now you will find a triangle, then that piece of triangle, this particular instrument is Jaeger lead plate. Jaeger or Jaeger, whatever you pronounce, Jaeger lead plate. It is used so that while giving the incision, it should not injure the eye. Okay, so Jaeger lead plate is used. Then you have to remove this particular portion. Okay, after this is the wedge which you have removed. Now see, while suturing, it should be correctly apposed. Suppose this one is, this length is bigger and you have not apposed correctly, like this you have apposed, then it is a defect. Okay, so that is why the proper apposition is necessary. Now it should be closed in 2 layers. It should be closed in 2 layers. First one is for subcutis. Next one is for skin. So while doing the subcutis, remember it should be buried inside. No part of the suture should be on the palpebral conjunctiva side, because it will irritate the cornea. Okay, so this is the only care you should take. So you can take a horizontal mattress, buried horizontal mattress, then put a knot, then go continuous, and after that subcutis you have to go for the skin. First suture should be a figure 8 suture. It should be a figure 8 suture. Okay, like this one, you see the figure 8 suture. Next, simple interrupted. Only thing, it should be apposed correctly. And remember, the sutures vary from as the species varies, 30 to 60. Okay, very thin, depending on size of the animal you are dealing with. In this way you have to do wedge resection. Okay, this is wedge resection. Next is Cilia Disorders. It can be of 3 types. Normally it opens from the cilia. If it opens from cilia, simply means eyelashes. Okay, so if cilia, here this is cilial opening from skin, this is cilia is coming out. Here there is a meibomian gland, simply oil gland. Okay, meibomian gland. If the cilia emerge from the opening of the meibomian gland, then the term is dystrichiasis. See here, this is B, image B. You see the hair or the cilia is opening from the, this is meibomian gland, from here it is coming out. It is known as dystrichiasis. Next is ectopic cilia. Cilia arise from the meibomian gland and emerge through the palpebral conjunctiva. Cilia is originating from the meibomian gland. Instead of coming out from the opening like the dystrichiasis, it is coming from the abnormal opening from the, here will be the palpebral conjunctiva. This is palpebral conjunctiva. Through it will open to outside. Okay, it will irritate the cornea. Okay, ectopic cilia. Next is trichiasis. Trichiasis means abnormally directed. Okay, misdirected cilia. Normally the eyelashes goes outside like this, away from the eye. If it go towards the eye, then this is trichiasis. First one is this is normal. This one is dystrichiasis. This is ectopic cilia. This is trichiasis. Okay, normal is normal. Okay, when opens from the meibomian, it is dystrichiasis. When it opens from the abnormal opening from the palpebral conjunctiva, then it is ectopic cilia. When it is normal, it is normally opening from the hair, but the direction is towards the cornea. This is trichiasis. Okay, so these are the abnormalities of cilia. There are few surgeries for this. First one is for the dystrichiasis. For dystrichiasis, the surgical correction is known as cryoepilation. So what it does, this forceps is known as Chalazion forceps. Chalazion forceps or clamp, whatever. Chalazion clamp. Okay. So for dystrichiasis, I told you what happens. It opens through the meibomian gland. So what you can do, invert the eyelid, because meibomian glands are present towards the palpebral conjunctiva. So invert the eyelid. hold it with the Chalazion clamp. Then this is a cryoprobe, liquid nitrogen, cryoprobe. So this cryoprobe is applied to that particular cilia which is having the defect. Okay, so when you will apply this one, usually 2 cycles of freeze and thaw are used. 2 cycles of freeze thaw. It means simply first you have to freeze, then wait for thawing, then freeze, then thaw. Okay, 2 cycles of freeze thaw, then the cilia will be destroyed, then simply those cilia will be plucked out. Understood? This is dystrichiasis. Suppose there is ectopic cilia, so simply you have to hold the Chalazion with the Chalazion portion, then that particular gland along with the cilia is taken out surgically. This is wedge resection. This is wedge resection of that particular mammalian gland and the cilia. Here you can see it should have opened here, then it is dystrichiasis. But instead of opening through the duct, it is opening through the palpebral. Here will be the palpebral conjunctiva. These all are palpebral conjunctiva. Through that it is opening towards the cornea. Okay, understood? This is the ectopic cilia resection, wedge resection. Then the trichiasis. So trichiasis part you are doing for dystrichiasis simply the cryoablation. The surgery is cryoablation. So you have to apply simply 2 freeze thaw cycle. You have to simply just like the trichiasis. There you are applying to the palpebral side. Here you can apply towards the skin side. Okay, whatever which cilia you are finding having some trichiasis or abnormal direction towards the cornea, simply apply over them and pluck it out. Okay, so this is affections of cilia. Next is entropion. Entropion is basically inward rolling of the eyelid margin. You can see here, this is inward rolling of the eyelid, the lower eyelid which has been rolled inwardly. It can be conformation, which is basically hereditary. It can be due to the plasm, blepharospasm, okay, paralysis, or it can be cicatrical. Cicatrical simply means that suppose there is some injury. While injury there will be scar formation. When there will be scar formation, you know there will be contraction. So if there is abnormal contraction towards the eye, then it will invert towards the eye. So lower eyelid is more commonly affected than the upper eyelid. In brachycephalic breeds, you will find a medial entropion. Large headed skull dogs, you will find lateral entropion. Okay, it can be towards the lower eyelid, it can be medial canthal, then lateral canthus. All those things can be affected. So the surgery is basically, there are few techniques. First one is tacking technique. Tacking, it's a temporary technique, not a permanent one. This is a temporary technique. What it happens, it is a temporary technique. So what we have to do, suppose this lower eyelid is having entropion, so we have to take vertical matrix. So you have to take bite from the eyelid, slightly below the eyelid. This is the eyelid margin, so slightly below you have to take a bite. Remember, the bite should not pierce the palpebral conjunctiva side, only the skin will be taken. So one bite, then some distance, then another bite. Like this you have to take 3 or 4, whatever length you need. So you have to take 4 horizontal interpreted pattern sutures. Okay, now you have to tighten it. When you will tighten, there will be 4 row. Okay, 4 row or group, you can say 4 row will be created here. Okay, then simply suture it, so that this lower eyelid which is having entropion will get corrected. But these are temporary techniques. Okay, suppose you don't know what to do, then you have to refer it to the higher hospital, then you can do this temporary tacking technique. Okay, the more permanent one or the surgical one is basically the Hodge-Celsus procedures. Hodge-Celsus procedure. So what happens here, this is Jagger lid plate. Okay, because you are giving incision, it may not injure the eyeball. So you have to make one incision close to the eyelid, first incision. Next, second incision you have to take slightly in arc manner or crescent shape manner, like this one. Okay, and this particular skin patch you have to remove. Then you have to suture it. Here there is a rule of bisect. Rule of bisect. What it denotes? Rule of bisect. So first suture, it should be sutured exactly at the middle. This is the length, total length of incision. So exactly at middle, first suture will be placed. Now it is having two halves. So each half has a middle point. Then next here and here. Next then in middle, in between these two, these two, these two, these two. Like this you have to do the suturing. Okay. So this is the rule of bisect for surgical correction of entropion. This is Hordeolum procedure. This is tacking procedure. This is temporary one. This is more radical one. Okay. There is another process. Suppose I told you about lower eyelid. Now suppose there is a lateral canthus. Then the procedure is known as lateral arrowhead procedure. Lateral arrowhead procedure. What happens here? Simply just like that one. So here you have to remove a arrowhead shape. Okay, simply just like the lower eyelid one. Okay, so you have to take a arrowhead like shape. You remove the skin. Then here also rule of bisect will apply. Rule of bisect. Okay, first at the middle, then this segment, like this. You have to suture. Okay. Now here for medial entropion, medial canthus entropion, it is medial canthoplasty. Medial canthoplasty. Surgical correction is medial canthoplasty. Okay. Here it is simply a wedge resection. Okay. A triangular piece will be taken out, then it will be sutured. Okay, it is simply a wedge resection, just like wedge resection. But here you have to take a note that there is lacrimal opening. This is superior puncta, this is inferior puncta. So these two punctae should not be disturbed. Okay, it should not be, never be disturbed. You have to take critical care while giving the incision. So simply you have to identify those triangular pieces which you have supposed to remove, then simply remove one, then suture this one. Okay, so the medial canthus will get squeezed and the entropion will get corrected. Okay, medial canthoplasty. So you have understood four techniques. First one is tacking, second one is the Hordeolum procedure, third one is the lateral arrowhead procedure, and fourth one is the medial canthoplasty. So these are the techniques for correction of the entropion. Next is the ectropion. Ectropion is basically the reverse, that is the eversion of the eyelid. Lower eyelid only, does not happen in the upper eyelid. It is much less common than the entropion. Some breed have conformational, that is hereditary, like retrievers, Saint Bernards, bloodhound, cocker spaniel. In these species you may find naturally ectropion. It may be normal, it may not be pathological. Okay. The surgical procedure is V2Y blepharoplasty. V2Y blepharoplasty. Blepharoplasty. Okay. There is another name, Wharton-Jones. Wharton-Jones procedure. Wharton-Jones procedure. Okay. So here you have to make a V-shape incision. Here like V-shape incision. This is the base. Okay. So you have to remove that piece of skin. Simply not excise one. You have to do the undermining and this is skin should be separated. But at the base it should not be resected out. Okay. But at the borders it should be reflected. Now this portion will be sutured, this portion will be sutured, and this which you have created a flap, you can say a flap, this will be sutured like this. So this is V2Y blepharoplasty, like this one, V2Y. Remember the suture is usually 60, 70, 50 like this, not the 0, 1, 2. Okay. The eye is very delicate. Okay, so this is V2. Why? For the correction of ectropion. There is eyelid laceration. These cases might come. Okay, eyelid laceration. Simply you have to do the suturing. Remember only one principle while doing the eyelid laceration or wedge resection. The sutures should not be on the palpebral conjunctival site, which may irritate the cornea. Okay. Next, Chalazion is basically tarsal gland cyst. Chalazion, non-neoplastic enlargement of meibomian or tarsal gland due to blockage of its duct and insufficiency of its secretory product. It is a very painless swelling, yellowish to white appearance. You can see here. This is a Chalazion. So surgically what you can do, I told you regarding the Chalazion clamp. So here you have to apply a Chalazion clamp, then simply incise smaller one, remove the insipid pus content. You can do some irrigation and you can use the cryoprobe. Here the cryoprobe simply to freeze the cycle to destroy the tissues. Okay, so this is basically Chalazion and it's a repair. Next is Hordeolum or sty. Hordeolum or sty. Purulent bacterial infection of the meibomian gland. It is internal hordeolum, or gland of Jay's is external hordeolum. So what have let me tell you. So suppose this is palpebra. Okay. Now here is cilia. This is cilia or eyelashes. Now towards the inner one there will be meibomian gland. But towards the outer side there is another gland. This is gland of Zeus. So whenever the meibomian gland will be infected, then it is internal hordeolum. When the gland of Zeus is affected, then it is external hordeolum. Okay, internal and external hordeolum. Involvement of multiple glands are common. Most commonly Staph aureus infection, and it is mostly managed by medicinal management rather than surgical management. Okay, the hordeolum or sty. Eyelid neoplasia, it can be squamous cell carcinoma, all those things. Here you can see melanoma, small one. The surgery is, I told you, wedge resection is one of them. Okay, wedge resection, the affected part is removed. Wedge resection, it is, I told you already, when the lesion is 1/3 of the eyelid length, less than 1/3 of eyelid length, then this particular method can be used. That is wedge resection. When it is more than 1/3, then you have to go for H-plasty. This is H-plasty. Okay, H-plasty. So what happens here? It is a bit technical. Okay, kind of plastic surgery. So if you want the details of it, then it is in the book. In rough, what you have to do? Suppose this is the, here it is very small one. I am making you understand here. Suppose this particular tissue to be removed. So you have to measure. First you have to mark with marker. Suppose this length is important. Suppose this is 1 centimeter. Then you have to draw another length line which is 120% of this one, that is 1.2 centimeter. Okay. Now on the other side also make this one like this. Then you have to make an equilateral triangle here and here. Now what you have to do? First remove this piece. This piece is removed. Now you have to make a flap. Remove this triangular piece also. Now this flap is created. This flap is advanced. Okay, H-plasty also known as advanced flap technique. Advanced flap technique, because a flap is advanced. So it is advanced, then sutured. Here same principle. The suture should not be on the palpebral conjunctival side. Okay, it should be buried or towards the external side on the skin, or closure of the skin. Like this you have to suture. This is H-plasty or advanced flap technique for correction of eyelid neoplasia. Next is Cilia, very common. You might find this particular condition more commonly in clinical settings rather than other which we have discussed. Cilia is basically the prolapse of the third eyelid gland or the Hordeolum gland. Most common in dogs compared to the cats. Reddish follicular mass, reddish and pinkish kind of, should never be removed. Many times I have seen surgeons removing the Hordeolum gland. It should not be removed because it may cause dry eye which latter may result in KCS, keratoconjunctivitis sicca. Okay, because its significant contribution to the ear tear film, it has significant contribution, so it should never be taken out. As it can be done in two techniques, anchoring technique or pocket technique. Morgan pocket technique name. We'll see first the Morgan pocket technique. Morgan pocket technique. Here the Morgan pocket technique. What happens? There is one image actually not there. Suppose this is third eyelid and this is a prolapsed gland. Okay, you have to pull the third eyelid gland. Then you have to make two incomplete elliptical incision like this. You have to make incision. Now while you make incision, it will have two borders. So this far border, this is near border compared to the gland, this is near border. So these two far borders are sutured. Here it has been shown, it is sutured. So while doing the suturing, always remember the knots. It should not be on this side. That is, suppose this one will be anterior. Below is the anterior side. This is the posterior side. Posterior side will be towards the cornea or towards the eye. Anterior side is away from the eye. So while doing this suturing, the knots, it should not be on this posterior side. It should be on the anterior side. So you have to take care regarding this one. Then simply suture. In modified Morgan pocket technique, there is another layer of suture of cushing pattern is given. Cushing. Here is simple continuous. Next, another layer of cushing is given in case of modified Morgan pocket technique. Okay, so this is basically the pocket technique, Morgan pocket technique. Another one is anchoring to the orbital rim. Anchoring to the orbital rim. Suppose this is the prolapsed gland, then elevate the third eyelid, give incision on the fornix. When you will give the incision on the fornix, the orbit will be approached. Suppose this is the eyelid, you have to open this eyelid or deflect this eyelid and give incision on the fornix, then this orbit bone can be approached. Okay, so here is the orbital bone. You can see here orbital bone. You have to take incision like this. First bite over the orbital fascia or connective tissue or all those structures. First bite, then through the gland you have to remove this one like this, through the gland. Then another, suppose this is gland. Okay, this is lateral side, this is medial side. Okay, this is dorsal side and this is ventral side. So first you have to take a bite on the fascia of the orbital rim. Next on the lateral side through the gland, lateral side it will come out, then come out, then another bite to the dorsal side. Okay, like this, then another bite on the medial side, and finally it will come through the orbital fascia and it will be tied. Okay, so when it will tied, the gland will be adhered to the orbital rim. Okay, understood? Next, see here, it has been attached to the orbital. Here is the gland actually, so it has been anchored to the orbital rim. Then simply close the fornix with simple continuous pattern. You can see here, this is a cross sectional image. This is the gland actually, which has been adhered to the orbital rim. Okay, so this is anchoring technique for the correction of the cherry eye. Next one is the neoplasm of third eyelid. You can see different structures can happen. This is the squamous cell carcinoma, this is the lymphoma, this is hemangiosarcoma, this one is the adenocarcinoma. These different type of tumors, these are categorized on the basis of histopathological. By seeing them you may not be able to tell this one, but if you are experienced enough you can tell. Okay, but it is not confirmatory. From experience you are telling, but it is not confirmation is always through the histopathology. So whenever there will be tumor of the third eyelid, you can do wedge resection of the third eyelid. Suppose smaller one, then you take a wedge shape. Okay, then it is sutured like this one. You can see here it is sutured. Okay, simply. Otherwise, if it is extensive enough, then whole third eyelid can be removed. Okay, so this is basically the surgical affections of the eyelid and third eyelid. Okay, so this is all about today. We'll meet in the next class. Till then, tata, bye bye, take care.